How will a proposal to tighten up federal dollars for gender-affirming care play out in Vermont?
The Green Mountain State has taken a number of steps to protect transgender people, including with a constitutional amendment. Our Calvin Cutler explains how far that will go against the federal government.
This week, the Trump administration is floating new rules to try to curb gender-affirming care for minors.
This is not medicine, it is malpractice. We're done with junk science driven by ideological pursuits, not the well-being of children.
The Center for Medicare and Medicaid Services announced a proposed rule which would block funding for hospitals and clinics if they continue to provide gender-affirming care, and another would ban Medicaid funds from going to puberty blockers, hormone treatments, and therapy.
What it really does is slap a Band-Aid on a much deeper pathology, a much deeper problem, the underlying issue of gender dysphoria.
But because these rule changes target the money for the care and not the care itself, some are concerned gender-affirming care would have to transition to community providers who already face financial challenges. The announcement has some in Vermont, like the state chapter of the American Civil Liberties Union, deeply concerned about trans youth and their ability to access health care.
We're talking about reasonable, age-appropriate steps that can be taken that really dramatically improve outcomes for young kids and for older kids, and that are really made in connection with their parents and with their doctors.
The American Academy of Pediatrics supports gender-affirming care and says it can reduce the rates of depression, substance use, and self-harm. Vermont's legislature passed several shield laws for those who receive and provide gender-affirming care, and voters overwhelmingly codified reproductive rights into the state constitution. But if passed, federal rule change would still affect cash flow to hospitals.
Government shouldn't be interfering with the medical care that happens between a medical professional, a doctor, and their patient, and I'm going to do everything in my power to protect Vermonters.
There's a 60-day public comment period before the final rule will be issued. Reporting in Montpelier, Calvin Cutler, Channel 3 News.